Well, as India, like other nations, continues to take unprecedented measures to stop the spread of the deadly COVID-19, lockdown and social distancing are the tools of choice. All non-essential activity has virtually been shut down. It also means a freeze on most economic activity. And while this is truly a medical battle, the impact of social distancing will have far-reaching consequences. Are we staring at a recession? Can we do anything to cushion the blow? Speaking to me now is Dr. Kaushik Basu, Professor of Economics and Karl Marx, a Professor of International Studies, Cornell University, of course, former Chief Economist of the World Bank. Dr. Basu, complete pleasure to speak with you, though in worrying times. I just want to begin by getting your view on what is the kind of impact we are going to see of the lockdown, of social distancing? It's an imperative right now, but what is the kind of economic outcome we will see of this?
Tamanna, it's a pleasure to be talking to you. I just wish we were doing this in better times about other things. And also, right at the beginning, I should apologize to your listeners that I'm managing the camera and the microphone myself, which I've never done before. So pardon me if it is less than perfect. If there is a problem with the volume, tell me, I'll try to tamper with it. But straight away to the topic. The pandemic that has hit the world, as yet the numbers are nowhere near, and this is important to be clear, the big pandemics that we've had in the past. But it is spreading fast, it can go anywhere. The first reaction that we have seen in India, in several other countries, are the right reaction. You have to do a lot of lockdown, you have to do social distancing, and I have to say, I'm impressed that in India, which is usually quite an anarchic society, you are seeing a remarkable level of cooperation that are exceptional. What worries me, and where I think the world over, it's not being appreciated fully, is that we have to do all the things that we are doing now about the pandemic. But all these things will have economic impact. And the economic impact is going to come within weeks, massive economic impact. We have to prepare for that. We can't water down any of the measures we are taking to stop the spread of the pandemic. But we have to think in terms of careful policy interventions. And there are examples from history, I hope I'll talk about that, where you take measures, steps to mitigate the fallout of this. It's already clear from the numbers that are coming in. We know that in China, in January and February, industrial production collapsed by 13.5%, negative growth of 13.5%, which is a mega collapse. Goldman Sachs has just put out an estimate that the US in the next quarter, April, May, June, will expect a negative growth of roughly 24%, which means 1/4 of the economy is going to crash and go. These are huge predictions, and for a country which is relatively poor, India, emerging economy, this kind of a wave, if it comes, is going to be very, very difficult to handle. So where we need to put in a lot of effort, I have to say again, I'm glad that an economic task force has been put in place. I don't know the details of what they are doing, but we need to do a lot of very careful thinking. Can I give you one example of a particular kind of intervention that has been talked about? Right intervention to start with, but which will not be enough. Universal basic income, giving a cash handout to people. In India, in United States, around the world, this is starting. But we have evidence from past crises that when you give cash handouts, and I'm in general in favor of giving cash handouts to the poor, but in times of crisis, the cash handout may not be enough. If you get supply chains of food being cut off and shortages appearing, the richer people will spend whatever money needs to be spent on the food. So food prices will rise. If you give a handout to the poor, they will try to buy food, but food prices will rise once again to go beyond their reach because the rich and the wealthier will be spending their money. So along with universal income support, you will have to, at this point of a time, and I am again emphasizing that usually I hesitate about this, you will have to give support in terms of direct support, food being made available to them, basic medical care being made available to them. I want to make one more point. Stop me if you want to, but let me make one more very important point. And this is not just for India. India, United States, countries around the world. During this period of lockdown, there has to be mega effort by the government and by the private sector. This has to be a public-private partnership effort to shore up our medical system. Build new hospitals. China was doing this at mega speed. Get the hotel industry, give them incentives to say, close down these hotels, these end hotels, and start health facilities, intensive care units, and get this transfer. For that, you will need the government to step in, to give directives, to give incentives, to give orders. And you will need the private sector, which has the capacity to execute this, to do that. So during the period of the lockdown, you shore up your medical side hugely so that at some point you will have to ease up on the lockdown, or you can't keep a massive lockdown. At that time, again, the virus is going to begin to spread.
So let me come in, Dr. Basu. Let me come in. Let me come in. So you've spoken about a few very key points. One is how the private sector also needs to jump in, and we've seen a lot of corporate India talking about donations, etc. Some saying that they will be using their hotels, as centers if required to fight this battle. You've spoken about UBI. But the question is, what can we immediately do? Now, as borders are shutting, as trains, buses, etc. are shutting, and we have been seeing a large part of the informal sector, this is over the last 48 to 72 hours, trying to flee the cities to go back to their villages. Today, we have seen instances of groups of laborers and informal laborers sitting around with no work, wondering where they're going to get their next meal. And then you have NGOs, etc., who come in. What needs to be done on a wider scale to ensure that that kind of a calamity doesn't occur, even while we're fighting coronavirus?
Two things. The absolute immediate, you have to reach out with direct support, which is difficult. We don't even have the full mechanism for that. But as much as possible, direct support to the informal sector, which is a huge part of India. So basic medical facilities, you can't give a huge amount. Basic food, you can't give a huge amount. These things you have to give out. And we are seeing some parts of India beginning to take these kinds of steps. You have to begin to provide that. You also have to make as much as possible direct transfers of money. We now are able to make some straight into people's accounts. You have to do that. This is not the time when we should worry about the fiscal deficit. We will worry about that 6 months down the road to control that. So use money to reach out to these people as much as possible directly at this point of time. And then during the lockdown, work very heavy during the 2 weeks to put in place more longer run measures.
To the role of the private sector and corporate India. Today, we've had a mega marathon meeting between the Prime Minister and, the who's who of corporate India. And this is two-way. Now, you've had several governments come in and say that while, your temporary staff, etc., is on lockdown, don't cut wages, don't cut salaries, don't cut jobs. How long can that sustain from? What about help the private sector needs to actually sustain its businesses, both for large industries and sectors as well as for small and medium enterprises?
Yeah. So this is the private sector's incentives are being damaged in very unusual ways. It's worth clarifying that unlike other kinds of recessions, where the economy feels the pressure in all sectors, a pandemic-induced recession is very, very different. Some sectors will see a spike in demand. Medical facilities, even food in some pockets, there's going to be spikes in demand because people begin to hoard. Then you will see a glut in many areas, airline industries crashing, hotel industries crashing. So what will not help, which helps in a usual recession, is just pumping liquidity into the system. Over here, there has to be a lot of sector-specific intervention. You shut down some sectors, you give incentives to other sectors to expand. Tamanna, another very sensitive topic, but I think we have to make people aware of this as well. Yes, you want people to take all the measures that they are taking and even more. But we also have to realize that getting coronavirus is not a sentence of fatality. The best measures that are coming out on the fatality rate is 0.9%, a little less than 1% of those who are being affected by this. It is a fatal case, which is higher than in the Spanish flu, the great 1918 flu. It was 0.5% that was fatal. In this case, it's 0.9%. So it is bigger, but it's still not as big. So people ought to realize you should act the way you're doing, take every precaution, wear gloves, put on masks, stay in seclusion, but don't panic and cause yourself psychological damage, because by all the numbers still, we are far away from the worst pandemics. The thing is, this is happening in the age of digital connectivity. This is happening in the age of science at its best. So in many ways, it is only natural that people will get to hear all this information. But we must not take in the information in a garbled way and create scares of a kind that are not scientifically right. I'm not giving any sort of soft words of comfort, but some of this is not scientifically right. You have to take the steps of a scare without being scared, simply because the numbers suggest that yes, this is a pandemic, this can get much worse, but compared to the 1968 Hong Kong flu, compared to the Spanish flu, of course, 1918, the 1958 flu, this is still nowhere near any of those. We have to take every precaution, but keep ourselves psychologically strong and realize that the bigger danger right now, and that will round the corner, is the economic danger, which is going to first hit the poorest segments and then is going to go escalating. We have to take steps against that.
And I can't believe it, I am, but I'm going to quote Donald Trump, who has said, we cannot let the cure be worse than the problem itself. At the end of the 15-day period, we will make a decision as to which way we want to go. Now, this points to a conundrum. When he says, the cure being worse than the problem itself, possibly he's talking about the fact that the lockdown situation, and it's in various key areas of the United States, we're seeing something similar over here, might completely decimate businesses and economies, local economies, which will have a far worse situation than the COVID-19. Is it important to start looking at these mitigating factors at this point?
Yeah. Tamanna, Donald Trump has flip-flopped so much in recent times that I don't quite know how he meant it in what sense.
Yeah,
but
fair enough.
Indeed, but there is something to this, that when you are taking measures to prevent the spread, you have to keep in mind that 1 week down the road, 1 month down the road, there can be devastation that comes from the economic system collapsing. So what we will have to do is, again, a lot of intelligent lockdown. Another example I'll give, and I know that a lot of this is beyond my expertise, and you will have to bring in the health workers, the medical experts, but people who are becoming immune, probably because they have already had coronavirus and coming out of it. We have to have systems of marshalling some of these people into a kind of help on the economy. So the lockdown and many of these measures we will have to follow, but we will have to simultaneously put in also steps where it's not across the board everything being locked down. Some sectors, critical sectors being left open. Workers who are already immune, individuals who are already immune, being given large incentives to come in and provide health work support. That's the kind of measure that we will have to fine-tune and put in.
Right now, the challenge, of course, for India, which we're dealing with, is the coordination between centre and states, and every state figuring out its own way of going forward. We have seen some states coming in with large schemes of free rice, etc., pensions for farmers, workers. Do you think we need a broader, more homogeneous plan of how to protect the most vulnerable, and how also to protect smaller businesses which are most vulnerable to, being hit by the tsunami and being shut down?
Absolutely. India is a fully connected economy. Just trying to do something in one state or one region is not going to help, because things will just flow from one region to another. We need a very carefully crafted centralized plan. And this is really a humanitarian problem where we can put aside our political differences, bring in the best brains onto the table and devise plans. I am glad that there is a task force in place in India to do that. I don't know the details of what the task force is doing, but to give out guidelines across the country. And I'm also emphasizing something that was implicit in your question. The lockdown cannot be, no matter what happens, you look at no other fallouts but to an absolute lockdown. It has to be nuanced, measured, planned lockdown, keeping in mind that all of this will have an effect and have an effect the same way on health, mental health, physical health, 2 weeks down the road, 3 weeks down the road. So the planning has to be done with that in mind. It has to be all India directives being given. You need a lot of expertise. You need people who have general compassion for humanity to be brought into the plan that will be executed through this.
Come back to corporate India. Now, we've seen appeals from various sectors, the aviation, real estate, retail, etc., saying that, we've suddenly seen a collapse of business and we need help, whether it is on payments, on interest, on credit, etc. What are the kind of steps do you think we should be seeing? Is enough being done on the fiscal side? Is enough being done from the RBI, considering that a lot of nations have been very aggressive with their measures, their economic measures?
Yes, we need to do much more of this. And the problem to understand basically is the following. If one sector, if this was happening slowly, demand for flying going down, demand for hotels going down, the private sector would react slowly, hotels would close down, airlines would close down, and other kinds of activities would pick up. What's happening now is because the collapse is taking place over a couple of weeks or over a couple of months, there is simply no time and the financial incentive for the private sector in the middle of this chaos to move over. So what you need is a central government plan providing carrots and sticks to the private sector, saying that, look, we are giving you some financial support, close down half your hotel industry, move that over immediately to somewhere else where the demand is very big. So that's the kind of intervention that is needed, which is, I should emphasize, it's a combination of central bank policy, fiscal policy. It is not just a question of injecting liquidity into the system, which United States was doing in the beginning, but it's already picked up that that is not good enough. It's a very sector-specific intervention, allowing for very quick crossover of resources which are currently investment in one sector to another sector where the demand is going up, from a sector where the demand is collapsing. This will not be done by the private sector alone. The government is incapable of doing it on its own. You need PPP, well-designed PPP, so you have to bring in the effort into that. And I also want to say, because I didn't touch on this, the biggest, which you mentioned, the biggest worry is the small producers, the street corner stores. I mean, they have very little survival power beyond a couple of weeks. So we have to put a lot of attention to that sector and not be focused just on the big businesses and the big corporations.
Absolutely. I also want to get, your view on the healthcare sector. You've spoken about how we need to now divert capacities to, feeding the areas which are required, which will be healthcare. We've seen, frankly, frightening statistics of how few beds, ventilators, etc. we have if the numbers explode, which is not something we can rule out completely. How do we quickly escalate or, quickly try and escalate our capacities over here?
Yeah. Tamanna, first of all, we have to sort of get all the numbers in place. And we are already, thanks to the fact that India is trailing a little bit, and there is a little bit of comfort in that. By the global numbers, India is still way behind. We already know that of the people who get coronavirus, 5% is going to need intensive care unit support. Some, roughly 14%, will need oxygen support. Based on these, we can begin to estimate how much more intensive care unit facilities will be needed, how much more oxygen support will be needed. And we have to work on this at a very, very fast pace. And these are not expenditures which are impossible for India. It needs determination, it needs strong action. We have to put these in place within weeks. China was building up factories within hospitals within days. We have to do that kind of a thing, be ready with this so that 10 days down the road, we have enough of oxygen support for anyone who needs, intensive care unit support for anyone who needs. So you have to choose the sectors. There are certain sectors which can be ignored. The relatively more luxurious sectors can be ignored, but you have to put in effort into this, and it is possible, I believe.
One last point, Dr. Basu. Are we seeing enough, and my sense is we're not, are we seeing enough of global cooperation on these fronts? In these times of panic, sometimes it seems like it's each to his own or each to her own, whether it's countries, states, localities or families. And just to build that up to an international scale, really, are we seeing enough of the global cooperation that we need right now? Because this is everyone's problem.
Nowhere near. This is a common problem of humanity. It's like the climate problem, and this was unexpected. It's come. At one level, it's understandable when this kind of a thing happens. You scamper around thinking of your immediate surroundings. But no, we will do a grave injustice to humanity if the world does not come together. And it is possible. We need to be able to talk. So I know that there are parts of the United Nations, and I've had some conversations which are very quickly trying to scramble together global efforts. And just like you were earlier mentioning, that you need more coordination across states. This is a global problem. So this needs coordination across nations as well, and we have not seen enough of that. Much more needs to be done.
Absolutely. Thank you so much, Dr. Kaushik Basu there. Speaking after a very long time in a rare appearance on television. It's a super exclusive. Talking about what India and the world need to do to look at the economic fallout of COVID-19 as well, which is more grave than you think. He also calls for a nuanced social distancing and lockdown to figure out how to get more people out that are safe and healthy so we don't have far-reaching impact of a complete economic lockdown.